Grow your practice, grow your wealth, grow your impact. Find out how to spend less time in the dental chair and more time on the things you love.
Welcome back to the Dental Wealth Podcast. In the studio today.
In the studio. Got it. We got him to get on a plane from Dallas and be here just for you guys
home
today. This is like
I'm home.
treat for everybody.
If you're not watching on YouTube, then I guess you can't see my face at the studio.
Well, I can see your face. Glad to have you in the studio as always. This is great to have you.
Glad to be back with Mr. Morin himself. I didn't get to do my intro today. I feel incomplete.
Do your
inside.
intro. Do your intro.
And with me in the studio, as always, is the man himself, Mr. Eric J. Morin.
I say with me in the studio is Matthew. What's your middle initial again?
Ryan.
All right, I got to do this.
Matt Ryan.
In the studio with me today is Matthew R. Maffei. There we go. The awesome, the amazing, the exhilarating.
The Zoom, I don't know if you guys use Zoom or not, but Zoom has these graphics that pop up where you can if you do a thumbs up, this little bubble with a thumb comes up.
It's horrible.
So right now it'd be balloons would be flying in the air, fireworks. That's what we need. After Effects.
There's nothing
worse
worse than being in a client call and having balloons go up behind you in the Zoom.
And you didn't even mean it. You're talking about something serious and then balloons.
And then
come
balloons.
up.
Yeah, I'll be in the middle of some financial math and balloons will pop up. So it's
Zoom needs to, they're figuring it out. But I'm excited to be back in the studio. I think we got, you and I worked on a concept yesterday that, you've been putting a lot of time, energy, effort into. And we think it's something every client should look at. It's every dentist, any business owner should really look at these. It's an equation. So explain a little bit about what the equation is.
Well, I'll just talk about the 4 parts. I think what's most important is the 4 parts of value creation, which is when you're sitting down with a patient and you're thinking to yourself, because one of the things, and I've trained associates and doctors for years on language, but I think it's really important to understand how to serve your patient who's in front of you. And there's a lot of verbiage. But one of the things, we were just talking about how, you and I were just talking about this value creation for doctors yesterday. And we were talking about what goes into that. And that's what we want to talk about today. So I might even make this a shorter podcast today just because I just want you to just grab this equation or grab these 4 things. I don't even need it to be an equation because I really just want you to grab these 4 things.
Yeah. I think it's something if you're looking at how you guys can translate this equation back to your businesses. All right, so when you guys are presenting treatment, so you're share this with your associate doctors. This is 100% something you want to share with them. Anyone that's presenting treatment in your business, this is ultimately an equation that they could use to get more success out of what they're presenting.
So the first part is really the ideal outcome, and people want a dream result. And when your patient sits in a chair, this idea of value creation is this idea that your patients would really almost pay an unlimited amount depending on the value it create. And at the point where the price is higher than the value they assume that's created is the point where they say no. Yeah. Now it's interesting because they'll buy a $30,000 Louis Vuitton because they see the value. And by the way, that's all about status. And that's a whole nother conversation. But when people will pay for status, but there's a dream outcome, an ideal outcome that your patient wants. Mm-hmm. And it's really important, first of all, to understand that dream outcome. I think sometimes what ends up happening is a doctor sits down in a dental chair and then starts to diagnose and say, okay, well, this is your problem, and you need a cavity here, or there's a filling, or this is what an implant does. And this over-education process starts to happen. Instead of just stopping for a moment and figuring out what the perfect outcome would be. It's sometimes we get so busy in our day-to-day and our rushing and just doing the work we do that we forget that there's an ideal outcome for a patient. And we spend so much time over-educating. When you over-educate, you feel like you sound important, right? But when you over-educate, people are less likely to move forward with treatment. And I'll say that again. When you over-educate, patients are less likely to move forward with treatment. There's so many details. There's so much things that are caught up. They're just I don't even know what I should do now.
And they likely don't understand what you're saying anyway.
They don't know what you're saying. And so it's, key one is really focusing on what is your patient's dream outcome? What's their ideal outcome? What does every patient want to have? What would make them happy? Is Is it because this new smile is going to give them the ability to attract a spouse? And let me explain when I say that, because that's like, what? I mean, one of the greatest conversations I ever had was with an implant doctor who was telling me, I love doing implants on young people because it allows them to get a spouse, a family, a career. And so we can understand that in that situation, that there's an ideal outcome. And if you sit there and talk about all the implants and why it goes in and where it has to go into bone and the longevity and stop talking. Stop talking and just talk about the dream outcome. Just stop. They don't care. They don't know what you're talking about anyhow. And remember, they're only going to retain about 6% of everything you say. All that you need to understand is there's a dream outcome that they want to have for themselves. And if you can focus on that dream outcome and you can have a conversation of that dream outcome, that dream outcome might be to never experience pain in this tooth again, or whatever it ends up being. We spend too much time over-educating and not enough time focusing on outcomes. Yeah. And that's the first part. The first part of the 4 to understand is that you need to focus on an ideal outcome. Yeah.
Probably the most critical part of the whole equation is figuring that out.
Yeah, I mean, what does somebody want? Yeah. Why are they there? What's the part? So if we can focus on that and focus on that dream outcome, then we get to the next part, which is pretty simple, which is what's the likelihood then of achieving it? Your patient needs to perceive that there's a high likelihood of this happening. Yeah. So when you talk to them, the words you should be utilizing are less clinical and more confidence building. Mm-hmm. Or I might even move away from the word confidence building. Courage building might even be a better term than confidence building. Yeah. Because oftentimes for somebody to make the leap to move forward on certain services, there's a courage that has to happen. Mm-hmm. And confidence only comes when they look in the mirror, right? When it's all done. That's when the confidence happens. Yeah. When they go, I'm confident. Now they can tell 5 of their friends that, hey, look, I'm confident that if you go to Dr. Smith,
you're going to be taken care of.
You're going to be taken care of. But so we have these courage building conversations, and the courage building conversations are getting someone to get closer to the belief, the likelihood that the outcome is going to happen if they move forward on this procedure. So you get them really understanding the dream outcome. You need to understand the dream outcome. Yep. What is success for them? Stop over-educating them on, they didn't go to dental school, nor did they want to, nor do they care. You feel that they need to know all that, and they really don't. Yeah. They really don't. If I went back and said, even a Tower client, most of them, they just want the result. Mm-hmm. So it's when you spend so much time over-educating, I'll guarantee if you quiz this person, a week from now on everything you said, test me on this one. Go talk to your patient about all the things you're going to do, and then send them a quiz next week and say, hey, tell me about what I told you last week. They're not even going to remember even being in the chair most likely, let alone most of what you said. But
have them show up to the appointment and say, this is exactly the surgery I need. Guaranteed.
Well, here's the thing. Now here's a what they call this, a pro tip. Yeah. Here's a pro tip.
Pro tip.
That's a pro tip.
If you're watching virtually, pro tip, and then just whoosh, it just came on the screen.
So here's a pro tip. So a pro tip would be that you need to understand that most people make buying decisions on emotion and not logic. When you're overeducating a patient, you're overeducating in logic. Mm-hmm. Memory, I just said that they won't remember most of what you said. Yeah. But that's not necessarily true. They will have emotions attached to it. Yeah. People remember based on emotion. So let me give you an example. What were you doing September 9th, 2001 at 10 o'clock in the morning? No one knows. Yeah. What were you doing September 11th? Yeah. See, if I asked you where you were September 11th, 2001, you would know exactly where you were at, exactly what you were doing when the World Trade Center, buildings were hit. And that's how it works, right? We attach memory to emotion. And when something's memorable, we remember. So when you're communicating to a patient and you're actually delivering emotion, right, which is dream result, if you're talking through dream result, which creates an emotional response, that emotional response then triggers memory of why they should move forward on this procedure, and then the perceived likelihood of achievement coming, which is courage building.
Yeah.
And if you just start to focus on that part and get that down, then all of a sudden you keep moving on and realize that this is more important than anything else in your case acceptance. Stop over-educating. Stop trying to tell them how great of a doctor you are and all this other stuff. That these things are going to be the critical things that matter in a decision to move forward with treatment. Yeah,
I think the likelihood. This is why doctors on your website, you have before and afters. This is why you have all of this data to present to someone to say, all right, if you do this is the likelihood of you seeing it. Here's proof of the pudding, like right here. I think when you're trying to alleviate pain, you need to be able to quantify that and say, okay, so what does this actually mean? So having more of those two things. So that's the top half of the equation. What is the bottom half?
So
you got those two things down. You have a patient that comes in. You explain the ideal outcome. Then you say, this is the likelihood. If you do this, this is what your result will be. What's the next thing?
So it's called time delay. How quickly can I achieve this result? And this goes into a gym, right? One of the reasons why somebody fails in the gym is because there's a time delay. That we talked about in this podcast a few weeks ago about the time delay around personal development and the time development around wealth. And so there's a time delay. The quicker you can get someone to get to the result, the better.
Yeah.
So if you have custom clothes, right, and you say it's 6 to 8 weeks to get that custom shirt, they're less likely to move forward than if they could get that shirt in 2 days.
Yeah.
Right? If I could picture myself this weekend going out in that shirt, then I'm probably more likely to buy.
Yep.
But if it's a long way away, then the time delay makes me less likely to move forward because I've got this dream result and I believe that you can give me the courage and I get the courage to do it. But then I'm like, okay, well, we can get you in 27 weeks.
Yeah.
The 27 weeks is too long. I can't get the result right away. Well, we're going to be into, by the way, this is one of the reasons why implant companies are selling 24-hour implants, by the way, just so you guys know that.
Same day dentistry.
They're using the same psychology, right? Same day dentistry. It's using the psychology of people want things now. And when you can show somebody how to get something now, they're more likely to move forward than if they have to delay. You ideally do not want your patients to have to delay. You want as little delay as possible. The quicker you can deliver something, the more likely somebody is to move forward. Yeah. The quicker they get the results. So let me give you an example of what I mean. If I told you right now that if you gave me $5,000, okay, cut me a check for $5,000, I can instantly, insert your fitness goal. I can, instantly you would lose 30 pounds. So if you lost 30 pounds instantly, right? Yeah. Now you say to yourself, well, that's absurd, Eric. No, it's not. It's called liposuction. Yeah. This happens all the time. In fact, one of the reasons why plastic surgery is so big is because instead of going to the gym constantly, you can get the result now, right? Yeah. It's one of the reasons why pharmaceuticals are so large, because instead of meditating every day, you can get the results now by taking a Xanax or a glass of wine or whatever it is ends up being. The truth is that you can charge more the quicker you can deliver the result. Yeah. And so if I said to you, okay, you could spend the next year in the gym, eat crap. I mean, no, I said crap. You have to eat very healthy, very lean, give up all the good things you want, show up every day, get up at 5 o'clock in the morning. For 1 year and you can lose 30 pounds. Or cut me a check for 10 grand and you can do it in 5 minutes. Yeah. You'd be like, where do I sign up? Yeah. Right?
How do I do this?
And so this is the way it works in your case acceptance too, is understanding that people are more likely to move forward if they can do it immediately, if they can get the results as quick as possible. So you say to somebody, look, what's your dream result? Like, what's the ideal result? And then you move into the likelihood, and this is why we use testimonials and those types of things, or we use, right, we're increasing the perceived likelihood of achieving by utilizing, right, social proof, showing that the social proof is saying, hey, if you come to Dr. Smith, you're more likely to achieve this goal, and therefore more people go to Dr. Smith because they read the testimonials or the Instagram or Facebook or whatever it is. And so that solves that part of the equation. And now you got to get them to the time delay and say, okay, but now it's taking me 27 weeks to get into this person. Yeah. Well, the quicker you can move them to that dream result, the more likely someone's to move forward.
And we've seen this too. Like we saw a lot. I remember this. This just kind of popped in my head. I remember all the people we used to talk. We had a lot of people for whatever reason 4 or 5 years ago that were for whatever reason doing an hour and a half new patient appointments.
It's an old paradigm. And some people still do it. If it's you, we're not knocking you. It's just.
But ultimately, it goes down to the time delay.
But it goes down to time delay.
When you're having that objection, the reason why your new patients aren't high is because you're telling your new patients, okay, to get a cleaning exam, an X-ray, is actually going to take you an hour and a half, and they're like, what?
That's right.
Why? And that's the reason why they can't get those across the line is because of the time delay. So some form of the fraction is off, and I would argue that it was time delay, and that just kind of popped in my head, and I was just thinking that's kind of funny because this kind of proves that point.
Well, it's the same way. Like I have an implant that someone did for me that, it's just not turned out to be the best experience. Let's just say that. Okay. And then, so the doctor's response to me is, well, I can fix it. But what we'd have to do is we'd have to take out the implant. I then have to put new bone graft in, and then you have to wait 6 months for that bone graft to heal. Yeah. And then we're going to have to wait. Then we're going to have to put in the actual screw. In fact, that's probably not the dental term, but anyhow, the implant. I'm just kidding, guys. So put in the implant, right? And then we have to wait 6 more months for it to heal. Yeah. And then eventually, I get to put the crown on, right? So I got a year in this process. How motivated am I right now to do that implant? Like zero, zilch, none, nada. Yeah. And look, the dream outcome is that I don't have what I seem as not right. Mm-hmm. I could tell you the whole dream outcome, but. Right, I believe this doctor could achieve this. If I rated that, I believe that this, although based on the first experience, maybe not. Yeah. But I believe this person could do this. Yeah. But the time delay is so long that I'm just like, I don't know if I want to wait a year to do this. And so now some of you clinically right now are saying, yeah, but you got to wait a year. You have to understand the bone's got to heal. This is not about your clinical training. This is about getting people to move forward. Yeah. And I'm talking to you why people do not move forward and why they do move forward. And so I just want you to understand that there are reasons why people move forward and don't move forward. Yeah. There are reasons why people make the buying decisions that they make. And so if someone doesn't know where they're going, there's no ideal outcome. They're kind of up in the air whether you could even do the outcome. And then there's a long delay, right, to getting there. And then I'll get to the last part. And then all of a sudden you tell them, hey, why don't you go up front and here's a $7,000 treatment plan. And why didn't they sign up? They said they needed to go talk to their spouse. Let me tell you what, they're heading down the road. Yeah. Because you sit down with them. You over-educate them on all the reasons why this is the most important thing and how great you are and how this... Stop talking about metals. Like, stop. This is made out of this metal, and this metal is different, and this is this company, and this company is known for this. If you're explaining to somebody all of that, stop talking. I'm serious. Like, I don't care. You can say what you want. I'm just going to tell you. And you say, well, Eric, he doesn't understand clinically. Look, let me tell you right now. What I'm telling you about is patient moving forward. The patient does not care about the material. They don't care if it's plastic, titanium, whatever. What do they care about? The dream outcome. Yeah. They're like, is this going to ultimately last long term? Am I going to be beautiful? Am I going to be out of pain? Am I going to be more functionally sound? And does it last? And all they have to say is, look, we're going to use this material. It's an amazing material. It's going to last for a lifetime. You're going to be so happy, or whatever it ends up being. And the patient says, okay, because they just want the dream outcome. Yeah. You're going in there explaining to them this whole thing of let me explain to you why this drill is the best drill. Yeah. First of all, it's got a 12-bit chuck, and it's got a plastic trigger, and the trigger was made in Tokyo at this famous factory, and it's got a motor in it that's 427, it's like, who cares? Will it drill the hole the way I want the hole to be drilled? And the rest of it's insignificant. Yeah. But what ends up happening as clinicians is there's an overeducation process. Why? Because you're heavily educated. Yeah. So you feel that the patient needs to understand what you know, and they don't. Yeah. So once you understand that the patient doesn't need to know all that information, they just really want the ideal outcome, and then they feel you can do it, and then there's no time delay. And then we get to the question of how much effort does it take? Yeah. How much effort does it take on the patient's part? If it's surgery and something that they're going to have to take off a week of work for, or 4 or 5 days of work for, if it's something that's going to take, right, that they got to really deal with the surgical repercussions.
Come in 5 times.
If they got to come in 5 times, if it's a 3-step process, that's why people are like, come in first and we'll talk to you and we'll get to know you. Then come in again and then we'll do some x-rays, and then come in again and we'll do your hygiene check, and then come in again and that's why it's such a bad system. It's because the effort is so high to come to your office. There's still reason, I know why chiropractors do it, but it's still like there's an old Seinfeld episode where, imagine I would turn this back to Seinfeld. So there's an old Seinfeld episode where, George goes into the chiropractor's office and he walks out and he says to him, he's holding the bill to Jerry, and he goes, it's a $130 bill. Now remember, this was 1991. And he says, they didn't even do anything in there. He goes, what am I seeing, Frank Sinatra back there? And his point was, like, I made a point to come here. Yeah. I wanted to get my back fixed, and yet I'm still in pain. And all you do is take an x-ray, which means I have to come back again and you charge me, which means effort is high.
Yep.
You want to reduce the effort it takes for a patient to say yes. You want to reduce the effort that they're going to have to put into this, right? So think about the bottom part of what I'm saying, the last two. If there's no time delay or limited time delay and it's low effort, going back to my gym example again, now all of a sudden you walk in and boom, you get immediate results. And right, and all you do is cut a check, right? So let's go back to my gym. You can lose 30 pounds, cutting me $10,000. Well, it's immediate results, and you cut a check. Yeah. Low effort, right? Mm-hmm. Immediate results, no time delay. You'd buy it tomorrow. Yeah. If it's long time delay and a lot of effort on the patient's part, they're less likely to move forward.
Yep.
So if you can put those 4 parts together, dream outcome, like likelihood that this is going to be the place that you can get the done, giving them the courage. Yep. You reduce the time that it takes, or ultimately perceived on their part, to get the result, and then reduce the effort that it takes for the patient to get the result accomplished. Then ultimately speaking, now we're talking about cooking with gasoline here, and they move quickly. Mm-hmm. And so it's something for you to think about, and if you think about that more, the more likely you are to be able to get the desired role. And so this is just it's a marketing funnel. This is marketing, just not my language. This is ultimately marketing language, and understanding that when you're trying to move somebody to action.
Yeah, this is ultimately buyer habits. Like what gets people to buy.
Yeah, if you're trying to move someone to action, you want to really focus on those things. And there's a lot of people that are great at this type of stuff, but I want to bring a conversation to you so you understand that. Just focus on it. We're at 23 minutes. I told you I was going to keep this podcast short. I just want you to focus on those things. Like, go back and look at your case acceptance and say, go back and do some role play. Go back and look at the conversation. Go back and.
Which part of the equation is causing them not to move forward?
Yeah.
Identify that. You have to focus on the bottom part first. So time, delay, and effort. If you can accomplish that and make it basically a no-brainer to do it because of those 2 things, you're going to be in better success than just focusing on the outcome and likelihood to achieve. Just focus on the first 2 first to see, all right, how long is it going to take for someone to do this? What's the effort? If we can minimize that, then it becomes, okay, now we can switch our attention to ideal outcome, likelihood to achieve, and you'll have more success.
Yeah. Love it. So I hope you guys enjoyed. Grab some great content from this. Go back and put it in place. Share it with a friend.
Subscribe. Ultimately, when you guys subscribe to the channel, it allows other people to get it from an SEO standpoint. So this isn't me pushing our SEO on you guys, but the main reason we do this is ultimately so that you guys have the opportunity to share this with people, get this in people's hands. If you know someone that is struggling with, they just started a practice, or even if they're a $10 million practice and they just can't figure out how to get patients to move forward with treatment, or just get people across the line when they're on the phone, use this formula, help them out. That's why we say like, subscribe, and share. Do that for us. Great to be back in the studio.
Glad to have you in the studio, my friend.
It is always a pleasure. We will see you guys next time. Thank you.